That means you're extra
So, greetings. Willingly, everyone can hear me. As always, welcome to the space. I'm Deidre Sully, and this is Information with Deidre. So, what are we going to talk about today? Well, we're going to talk about poverty, public health challenges, right? And poverty is a big one. So, you might be asking, well, why poverty? So, like money, right? We were talking about money a few weeks ago. It's a part of everything. Well, poverty is one of the single largest determinants of health. It's mixed in there with everything. Poverty is a big determinant of how healthy someone is, and the access that they have to the things that keep them healthy. Um, when we think about like the poverty level, there's a threshold, right? So there's an income threshold that the United States has, and the World Health Organization does several thresholds of different poverty levels. I think it's $1.90, and then maybe $3 and something, and then $5.50. And for the U.S., there is an income threshold that we have as well. Greetings, Aquia. There's a threshold that we have as well, and that threshold attribution is based on family size and composition. So, depending on if a family falls below that threshold, then they are considered poor or under the poverty line, right? A lot of the times, so taboo to say poor, but I think it's really important to be very honest about certain things. There's so many different ways we like to say things to not hurt feelings. But I think if we stick with the truth, then we can start to work towards some solutions. Greetings, Sister Munira. How are you? We're talking about poverty. So we're going to make this really quick because this is not a new subject. Poverty has been spoken about at length. And at this point, we know that there are issues with poverty, how we got here, why we're still here. So we're just going to go over a few of those and spark discussion. So if any of you in the chat would like to chime in, add your 2, 3, 4, 5, 6 cents, please feel free. I didn't put the link to join me live, but if you are interested in joining me live, I can definitely share that so that you can go live. We are also live on Facebook. So for those of you on Facebook, greetings for joining. I think Aquia is on Facebook. So greetings to you, Aquia, and greetings to those of you who are joining on YouTube. So back to poverty. So we were talking about, there being a threshold, and that threshold is attributed based on family size and composition. So size, obviously, is 2, 3, 4, 5, 6 person family. Composition, some of that, it really falls under how many children, if it's just man and woman, no children, or is it a family with children? If 2 parents are in the household, mother, father, child. So that is a big part of poverty, of what determines the poverty threshold. One thing that I do want to share is, for the culture that I lead, for my life, or I live for my life, which is new. We talk about poverty, and one of the foundations of poverty is that, we have to avoid it. Why? Is because it's worse than any plague. And I think that that's truth, right? We see it in front of our own eyes that it can be worse than any plague. Not, it is worse than any plague. It is, people are basically subject to those who have access and wealth, that they don't. And wealth is not always, money. Sometimes wealth is family. Wealth are those things that keep you above the water, way above the water. So why poverty? Like I said, because it's experienced by so many. the national poverty rate here in the United States is 13%. So 41 million people are living in poverty. And even globally, those numbers have definitely changed, especially since COVID. There's been some setbacks with poverty. So, according to the World Health Organization, the global rates were steadily declining over the last 25 years. And then with the onset of COVID, it just, knocked everything out of the water, as if, nothing ever happened. So at this point, there's an additional 120 million people who are now considered poor or below the poverty line globally. So this is a problem. Why? Because it does affect health. Like I said, it is the single largest determinant of health. And how we are able to operate. Another way we talk about, like, people experiencing poverty is like the socioeconomic status. So low socioeconomic status really meaning like, so there's less education, which means a lot of the times that means there's less money. The employment status may or may not be there. The occupation status also makes a difference. So depending on your level of education, it does determine what type of job that you can get, right? And sometimes the job determination determines the income. So it's all related. It's just this interrelated web and things that are intertwined that go with poverty. Another thing that all of those things, if there's a less education, less money, lack of employment or underemployment, occupation status is kind of iffy. It means that there's a lack of access to resources like information. So there's a lot of different programs that are around, but do we think about how many people actually have access to these programs or actually know about them? So it brings to mind, especially with the onset of COVID, and we'll talk about this in the True Health Live podcast coming up this week, when it comes to telemedicine. So one of the things we have to think of when it comes to those who are poor, do they even have the technology to have remote medicine? Um, Here's like a little story. In my work with tobacco, there is some work with youth, and there was a reality check that some of us had, where some of the students, they weren't necessarily able to interact with our program, which is extracurricular to school, but because we kind of work with them through school, we get to see, like, some of the ways that they engage and interact. And one of the students, had a little bit of a difficult time because she actually had to borrow one of the laptops that the schools were giving away, because again, we're working with underserved youth. So not everyone has access to a laptop or a desktop in their home. Yeah, smartphones may be, somewhat commonplace now and easier to get. I wouldn't say easy, but easier to get. So, people have smartphones, but like, you can't necessarily do school on a very small smartphone for hours on end, for months and months, and we didn't know, like, when this was gonna like let up. So part of what we kind of were open to, or our eyes were open to, is that this student, she had to tell us, like, she wasn't necessarily able to engage in all of the activities because she didn't necessarily have Wi-Fi in her house. She had to go to a store, one of the businesses on the block that she lived, and use their Wi-Fi. And it was the kind of place where you can kind of go in and sit down. I won't, name the business's name because we're not doing any promos and sponsorships here. But she had to go and use their Wi-Fi for that. But then what happened? Everything shut down. So now there's no access to Wi-Fi. So how is she going to, number one, do school, which is the most important, and then how is she going to engage with us? So that was a real eye opener when it comes to poverty and how it affects young people, because globally, young people, children, are the highest percentage of those who are poor. And it's women and children make up 70%, and children make up over half. So this is a reality check. When it comes to poverty. And as public health professionals, we're like natural or automatic advocates, right? For those who experience health disparities that are results of poverty. Because a lot of the times we work in programs and organizations that provide different services that do address social determinants of health and address different needs, or where there are gaps in health or health care, so that people who don't necessarily have those opportunities and access, we can bring that access to them. And so by the mere fact of us, when we're writing grants and making a case for all of these things, that is a little bit of advocacy and advocating for those who are less fortunate and those who suffer from poverty or below the poverty line. So another thing, so we talked about like a real example. We talked about like, young people experiencing poverty and who's experiencing it more. I want to kind of go back to the telehealth example. So again, so like when we're thinking about like, how we're moving now. So COVID kind of brought on a lot of new ways that we move. And so engaging with our healthcare providers in a digital way, in the digital landscape, is not necessarily something that people who don't have that access can do. So what happens to them as we are, kind of moving toward this new digital age? Do they get left behind? So we have to think about some ways that they can also engage if we're moving toward less like in-person visits, which they definitely cannot not stop, because there's things like surgeries and things, and we're not at the, that age yet where everything is like so techno that we can have machines in our homes that do them. Maybe us who are here now will still be alive when that's around, but that's not where we are now. So yeah, we're still having in-person visits, but more and more telehealth and telemedicine are becoming a part of how we do things, and they're not necessarily new concepts. They are the same, they're one and the same, but it's not a new concept, because we've been engaging in those type of practices for a while. When your doctor calls the pharmacy, that's basically telemedicine. Telehealth are the actual like applications that they use to engage with patients. But again, when we're engaging in a lot of these remote activities, if the technology is not there for someone who experiences health disparities or experiencing poverty, then what do we have? So yeah, like I said, most people have smartphones and things like that, but they're not necessarily carrying the same functionality all the time that a desktop or a laptop would, or a device, even a tablet, that would allow you to have that very like clear way of communicating, or clear equipment to communicate with your physician. Not to mention, a lot of the times when we're talking about people who are below the poverty level, they don't even have the funds to actually have primary care physicians, let alone a specialist. So how is their care getting to them? Just going to go back to the chat really quick. Shalom, Precious. My name is Precious. Thank you for joining us. So I want to go over how did we get here. So there's a few things that we can talk about. So number one, there are policies that have been put in place over decades that have never been fully or meaningfully addressed in a way that helps those who are in need, or less, who are vulnerable, who are underserved, and less have access to less resources. And the other thing about that those policies have never been reversed, eliminated, or nullified. More and more policies get passed, but do we ever really go back and strike certain things from the book? We know that from the 13th Amendment. No, nothing necessarily gets struck from the books. So how do we meaningfully address things that have been put in place in the past that actually cause devastation in specific groups? The other thing that I wanted to point out, that I found in my research, marital status. That's also a determination of how we get here, like poverty. So, when they talk about families that experience poverty, there are single mothers are at the top. They experience poverty the worst. Then we have two-parent households, and then we'll have I may not even remember this in order, but then there's two-parent households. Then there are married couples with no children, married with children, and then single fathers. And I don't necessarily have that in order. But like I said, remember, the composition of the household makes a difference on how you may or may not be affected by poverty. Of course, there are also the other items that go into effect that are to be taken into account. But it was interesting to see that marital status and like how the composition of your family makes a big difference on how you experience poverty. So basically, like two-parent households are better than one, but I think we all know that. So mother, father, children are, is a it is most likely, it's your least. I wouldn't say least likely, but you have a better chances of two-parent household than single-parent household. But again, I think we all know that. We just have to start acting like we know it. So other thing is location, right? Zip code. And that's one of the things that we say we talk about in public health all the time. Your health, the way that how healthy you are shouldn't depend on your zip code. And the unfortunate reality is that it does. And that kind of brings us back to that idea about policy, right? And like what laws are in place and what laws and legislations have been maintained. Are they maintaining the status quo of underserved neighborhoods? And I think we all see that that is the case in many, many, many spaces. People who live in rural areas do experience high rates of poverty. We know people in urban areas as well experience high rates of poverty. And a lot of the times we don't necessarily see them because when we're in the city, we only see that kind of version. There's definitely other versions of poverty that are out there. And when we don't pay attention to different legislation that affects different areas in different ways, then that's how we kind of get that. Some people get left behind. A lot of people get left behind all the time. And like to give you an example of that, like 40% of the global poor, they actually live in economies that are, you know, um, affected by violence, floods and things like that. And violence, I definitely wanted to point out because what I noticed today, and I'm sure everybody has noticed, today is June 1st. And it is the last day of the anniversary of the Tulsa. I don't want to say riots, but the attack on Greenboro in Tulsa, Oklahoma. And so when we think about something like that, that is, trauma sets in, right? So how much poverty is caused by trauma? Because that trauma then, which is it becomes a mental illness. So how much of that, becomes a reason why people stay in poverty, those generational curses. And so when we think about like people living in war-torn areas or areas that are just devastated, there's economic blight, that also becomes like a continuation because it's like from generation to generation. Sometimes people feel like, well, there's nowhere to go. So how do we provide economic mobility for those areas? And again, we go back to policy. What policies have been put in place that just continues the status quo for those areas to keep the people that live there and have made their residence there in poverty? I want to just read a quote from a book from a tome that's really important to me when it comes to, it's a quote from the Outweighs by Chief Yuya regarding poverty. It is present when there's a lack of resources, good housing, relevant education, genuine healthcare, and a presence of overall human suffering. So those are all the things that we just talked about. And when we think about like that overall human suffering, it's like all those different factors that come into poverty that kind of keep you mentally stuck. And then there's generations and generations that are kind of moving in that same way. Yes, we do have outliers and people that make it out, so to speak. But generally, but if that was happening at higher rates, we wouldn't have, a poverty rate as high as we do. Even here nationally, when we talk about poverty, they've been, I will say the poverty rate has been steadily declining. So the highest was 2013. Since 1959, the highest of poverty, which was like 9.6 million people, was in 2013. And now the poverty rate is sorry, not 9.6 million. Oh my God, I lost my numbers. But the highest rate was 2013. And so they have been steadily declining. However, COVID has changed a lot of that. People have lost jobs. And again, when people have insecurities like housing insecurity because they can't afford to pay the rent and things like that, it has shifted people into different brackets. So those are some of the things that we have to think about. Like, how do policies, family composition, our location, how does all of that fit into, or not even how, it does all fit into what goes into how people experience poverty, or if they even experience poverty. And then just having very real conversations and understanding about how that becomes a generational curse for people. So how do we get out? How do we? Well, we kind of talked about it. We have to address policies in a meaningful way. And when we're thinking about policies, it's like true, like real education. So as a person who is a health policy advocate, it is my responsibility, and so like many others who are advocates, it's our responsibility to provide, education, relevant education that resonates in a way that people can understand, in a way that can relate to the people who are on the ground. Like, how do they take the information that we're giving them and use it, to empower themselves? So we have to, provide information in a way that's understandable, alert people to, not just like moving off of emotions for policies that they think, when the front facing language is given to them, that it's all good, but like learning how to look them up when they're announced, learn about rulemaking, learn about how policies are put in place, how legislation is done. It's not just a bill on Capitol Hill. It's actually deeper than that. So like learning how those things are done so that they can make informed decisions about how they move, how they live. Like we talked with the licensed clinical social worker, and one of the things that definitely came up, as well as the EMR consultant Munira. So both Elaine and Munira in the career spotlight talked about, like, higher degrees, how they will help, but also not necessarily breaking the bank, right? So there's things that you can do when it comes to, addressing some of those things that fit within that are markers for poverty, like the education, the income. So like, you can go to school for free. You can get higher education for free if you're a resident in New York. And there's a lot of different programs that allow for people to have higher education so they can change like their trajectory. When it comes to policy, really being mindful of what you're signing up for and what you're actually marching in the street for. There has to be like a real education on that. And just overall be aware of what is happening. So, those are like some real easy ways, and they really fall under education. So being educated and informed on policies that affect you, and in a real way, and not just that front facing language, and also education. So really being mindful of higher education opportunities that will allow for skill building and open doors. So it's that economic mobility that we have to really pay attention to. And so, education really helps a lot of that. And if education or higher education is not your go-to, job training. So there are definitely a lot of programs that offer job training and skill building. And so these are the things that kind of, again, like put you in a different bracket and that can possibly change your trajectory. There's also different programs. We've talked about this before when we talked about money problems. So there's different programs that the federal government has put in place for people who need them. And there's different opinions and feelings around welfare. Let's call it what it is. There's different feelings and opinions around it, but they were created for the people who need them. We do know that there are other um, sinister machinations around that as well, because that is also what helped remove Black fathers from the household. So I want to make sure that we're looking at the truisms in a holistic way. So So being mindful of all of the opportunities that are there. So there are different programs that you can look into, by whether it's federal government or federal government, by given through a nonprofit that's funded by government or private funds. And so, really being mindful of what's available in your community, looking at job training, looking at whether there's free education that's available to you, and then also being mindful of how policies and legislation is passed. And so, again, with that last one about policy and legislation, is really advocates who are, kind of like the go betweens. And it's really on us to kind of help our communities. If that's what we got into this for, it really is on us to help our communities understand some of those things. Because by doing that, we are helping to address the overall poverty rate. We may not see, like, a big jump, but, like, small steps are always welcome. So, with that, that is our discussion on poverty and public health, because it definitely is a public health challenge that touches everything. It deals with housing, it deals with food and nutrition and how we move, where we live. It touches everything. So I encourage everyone to really look into more information on poverty, and I'll put more in the discussion or the chat. And if you have any questions, please feel free to reach out to me at deidresully@gmail.com, or you can reach out to me at www.deidresully.com and make a comment on the website, read the blog, listen to the podcast. There's all these different ways to get in touch, or you can just simply leave a comment down below. So, without further ado, make sure you follow, like, share, and subscribe. Hit the little subscribe button down at the bottom for more content, so you can be alerted when we make new videos. So we'll be back on Thursday at 7 p.m. again this week, where we will be interviewing a CEO. I'm so excited. It's going to be so fun. So thank you for joining us, everyone. Peace.